CNA Perineal Care Female. Welcome to the quiz. Question 1. You are working on a unit where you care for multiple patients, some with infections requiring special precautions and others without infections. You understand the importance of preventing cross-contamination between patients. Based on proper infection control techniques for preventing cross-contamination when caring for multiple patients, what should you do? Option A. Use the same gloves for multiple patients if you change hands frequently without removing them. Option B. Perform appropriate hand hygiene and change personal protective equipment between each patient contact. Option C. Use the same equipment for multiple patients without cleaning between uses. Option D. Keep patients' personal items and belongings mixed together for convenience. The answer is B. To prevent cross-contamination, perform hand hygiene and change PP between patients. Option B is correct. Options A, C, and D spread infection. Question 2. You are learning about the role of nursing assistants in patient advocacy and ensuring that patient needs and concerns are addressed. The nursing supervisor is discussing the importance of speaking up on behalf of patients. Based on understanding of the CNA's role in patient advocacy, which statement accurately describes the role of the CNA in patient advocacy? Option A. CNAs have no responsibility for advocating for patients. Option B. CNAs should report patient concerns to the nurse and appropriate personnel and help ensure that patient needs are communicated. Option C. CNAs should only follow orders without asking questions or advocating for patients. Option D. Advocacy is only the responsibility of physicians. The answer is B. CNAs advocate by reporting patient concerns and ensuring needs are communicated. Option B is correct. Options A, C, and D are incorrect. Question 3. You're reflecting on what it means to be an excellent certified nursing assistant and what qualities are most important for this role. Based on understanding of the essential qualities and characteristics of a good CNA, what is the most important quality for a CNA to possess? Option A. Physical strength alone is the most important quality. Option B. The ability to work quickly without concern for accuracy is what matters most. Option C. Compassion, patience, dedication to providing quality care, and concern for patient dignity and well-being are the most important qualities. Option D. The ability to work independently without asking questions or seeking clarification. The answer is C. The most important qualities for a CNA are compassion, patience, and dedication to patient dignity and quality care. Option C is correct. Options A, B, and D are not the core qualities. Question 4. You are assigned to care for Mrs. Eleanor Patterson, a 78-year-old female patient who was admitted to the medical surgical unit 3 days ago following knee replacement surgery. During your initial assessment this morning, you observe that she appears uncomfortable and is moving around frequently in her bed. When you ask her about her comfort level, she reports experiencing sharp, throbbing pain in her right knee that radiates down to her calf. She tells you that the pain medication prescribed to her seems to be less effective than it was yesterday, and she is concerned about whether the pain is normal or if something might be wrong with her surgical site. She has not had her dressing changed since yesterday, and you notice the edges appear slightly loose. Considering all these factors and the clinical presentation, when assisting a patient with pain management and postoperative care, which action should be prioritized first among all the options available to you? Option A. Immediately apply heat therapy to the affected knee and encourage the patient to perform gentle range of motion exercises to help manage the pain independently and improve circulation to the area. Option B. Notify the nurse right away about the patient's increased pain, changes in pain characteristics, and concerns about the surgical site so that a comprehensive assessment can be performed and appropriate interventions can be ordered. Option C. Document the pain complaint in the patient chart and then assist the patient with distraction techniques such as watching television, listening to music, or having family visit to help redirect her attention away from the pain. Option D, suggest that the patient request additional pain medication from the nurse, and in the meantime position her as comfortably as possible with extra pillows while waiting to speak with the nursing staff. The answer is B. The correct action is to immediately notify the nurse because the patient is reporting a significant change in her pain pattern, now radiating to the calf, and there are visible concerns with the surgical dressing. These are red flags that could indicate a serious complication, such as deep vein thrombosis, infection, or surgical site issues. A licensed nurse must perform a comprehensive assessment before any intervention. Option A is wrong because applying heat and performing exercises without a proper assessment could worsen an undiagnosed condition, e.g., heat increases inflammation, exercises might dislodge a clot. Option C is incorrect because although documentation is important, it should never replace immediate reporting of a critical change. Distraction techniques do not address the underlying problem. Option D is incorrect because suggesting specific pain medication is outside the NAURO's scope of practice, and simply positioning the patient delays the necessary evaluation by the nurse. Question 5. You are working the morning shift on a busy orthopedic unit and are responsible for the care of 6 patients. During your rounds, you discover that one of your patients, Mr. James Rodriguez, a 65-year-old male who had hip replacement surgery 2 weeks ago, is reporting severe sharp chest pain that radiates to his left arm and shoulder. He appears pale and diaphoretic, and he tells you that he feels dizzy and nauseated. His wife is at the bedside and is extremely concerned about his symptoms, asking you repeatedly what is happening and whether he is having a heart attack. Mr. Rodriguez is visibly anxious and his breathing appears rapid and shallow. When you assess his situation, you realize this could represent a serious cardiac event or another life-threatening emergency. Based on this clinical scenario and the patient's presenting symptoms, what is the most appropriate and immediate action you should take as a certified nursing assistant? Option A. Assist the patient to lie flat in bed to improve his circulation, place him on bed rest, and then go to find a nurse when you have finished making him comfortable, explaining to him and his wife that chest pain is not uncommon after surgery and usually resolves on its own. Option B. Stop all activities immediately, stay calm, keep the patient calm by reassuring him, call for the nurse immediately using your call system or by notifying another staff member, and monitor his condition while awaiting nursing staff who can perform a comprehensive assessment and provide emergency interventions. Option C. Ask the patient to sit up in a chair to help with his breathing difficulties, suggest deep breathing exercises, and tell him to try to relax while you go retrieve some antacid medication from the supply room that might help with his chest discomfort. Option D. Document the patient's symptoms in detail in the chart. Wait 30 minutes to observe whether the symptoms improve on their own, and then notify the nurse if the symptoms persist or worsen, so that assessment and treatment can be delayed until you are more certain about the severity. The answer is B. Immediate action must be to get the nurse because the patient is exhibiting classic signs of a heart attack, chest pain radiating to left arm, pallor, diaphoresis, nausea, dizziness. This is a life-threatening emergency. Option A is incorrect because lying flat may not improve circulation in a cardiac event and could worsen breathing. Also, leaving the patient to find a nurse without calling for help first wastes precious time. Option C is wrong because sitting the patient in a chair and giving antacid is inappropriate. Chest pain of cardiac origin is not relieved by antacids, and leaving the patient to get medication is unsafe. Option D is extremely dangerous. Waiting 30 minutes or documenting before notifying the nurse delays critical intervention and could result in cardiac arrest. The only safe action is to stay with the patient, call for the nurse immediately, and provide reassurance while monitoring. Question 6. You are caring for Mrs. Patricia Chin, an 82-year-old female patient who is obese with a body mass index of 38, has limited mobility due to severe osteoarthritis, and requires maximum assistance with all transfers and repositioning. She is currently on bed rest following a fractured pelvis. This morning, she needs to be transferred from her bed to a wheelchair so that she can sit up for breakfast in the room's comfortable chair. Mrs. Chin is anxious about the transfer process because she is worried about falling and potentially injuring herself further. You know that improper transfer techniques could result in injury to both yourself and the patient. When considering the safest and most appropriate method to transfer this patient from bed to wheelchair while ensuring the safety of both the patient and yourself, what intervention represents the best clinical practice? Option A. Recruit 2 additional staff members to manually lift the patient by having them place their arms under her axillae and lower extremities. Then lift together using their leg muscles while the patient remains passive and allows them to do all the work of the transfer. Option B. Request and utilize a mechanical lift device, such as a Hoyer lift or other approved patient transfer equipment, with the assistance of at least one other staff member to ensure proper positioning, secure attachment of slings, and safe lowering into the wheelchair while maintaining the patient's dignity and safety. Option C. Encourage the patient to stand and pivot independently toward the wheelchair, assisting her only minimally by holding her arm and providing verbal cues. Even though she has indicated her fear and anxiety about the process and has significant limitations with mobility. Option D. Have the patient slide herself across the bed toward the edge using her arms, and then attempt to stand with minimal assistance before pivoting to the wheelchair, explaining to her that this will help maintain her independence and strength. The answer is B. The safest method for a patient who requires maximum assistance, is obese, has limited mobility, and is anxious about falling is to use a mechanical lift. This protects both the patient and staff from injury. Option A is incorrect because manual lifting, even with multiple staff, places staff at high risk for back injury and the patient at risk for falls or skin shearing. It is not recommended when mechanical lifts are available. Option C is wrong because this patient is not capable of independent pivot transfer. Encouraging her to do so despite her fear and physical limitations could cause a fall and further injury. Option D is also unsafe. Sliding across the bed can cause skin breakdown, and attempting to stand with minimal assistance is not appropriate for a patient on bed rest for a fractured pelvis. Using a Hoyer lift is the evidence-based, safe choice. Great job! Don't forget to subscribe. Bye.